Well, always growing up, I remember my mom always had problems with brittle teeth, and I started noticing that my teeth were becoming the same way, and that no matter what I did with them as far as dental visits or any type of care, they just seemed to continue to get progressively worse, and it was my top arch that was really bad. So that's why I wanted to get that done so I wouldn't have the chipping teeth, the broken teeth, and the pain associated with that. I love not having pain in my mouth. I love not worrying about what I've got to eat and what side I've got to chew on and where the most recent damage is anymore. I can bite an apple, or I can chew gum, or even black licorice, which I'm the only one in the house that likes, so it's good for me. So yeah, I mean, I eat all normal foods. I eat too much of it, actually, so I gotta do something about this blood pressure.
I've known Dr. K for about 10 years now. He's handled a lot of the previous work that other dentists have tried to fix, that he's given me permanent solutions for, some of the crowns failing. The big thing with the implants is a lot of the ones I've had to have done were replacing work previous dentists. So I do feel it's more of a permanent solution. I don't have to worry about cracking crowns or losing crowns because of my TMJ, because this is a more secure and more sturdy solution to the problem. Day to day, I don't worry as much about grinding my teeth because of having sturdier implants instead of a crown. I have less jaw pain because of it. So I think overall, long term, it was definitely the best way to go.
So before I met Dr. K, I had two teeth pulled years ago, 10, 15 years ago. And so I'd lived all that time without those teeth. And Dr. K, one of the first things he mentioned was the implants, and gave me examples of his clients and how it changed their lives as far as their oral hygiene goes. So the more we talked about it, the better it sounded, and it worked out great. So I can chew again on both sides of my mouth. Obviously that makes a world of difference. I think it's helped with my taste, just overall health, I guess, as far as oral hygiene goes.
I'd seen several dentists before Dr. K, and never really trusted any of them all that well. It just kind of, it wasn't very comfortable. And by the time that I went to Dr. K, I really didn't have a lot of trust, like I just said. But he was very reassuring, and then when he did the work, it was wonderful. It was high quality, and that's really what you want in a dentist. And you also want a dentist that won't try to give you procedures that you don't need, and he wasn't like that at all. He's very trustworthy. The first procedure I actually went to see him for was I was experiencing pain in the back of my mouth, and I'd had a root canal that had gone bad, and he went in, cleaned it up, and that was my meeting with Dr. K from there on out, and that was in 2006. So after that, it was just, I went in for checkups, and he occasionally would see things that needed addressing, no problem. I wound up, because he sold his practice at one point, I wound up seeing another dentist. Experienced what I had experienced previously prior to Dr. K, and looked him up, found him again, because I really trust him. He's a good dentist. I would absolutely recommend Dr. K, because it's very difficult to find a provider, a dentist that you not only trust, but is going to do a great job. I mean, if you want not just a pretty smile, but if you want a healthy mouth, absolutely. Dr. K all the way.